Lisa.
Hello.
And welcome today. Thank you once again for loaning me your hands to practice on. So what I'd like to do today is first of all just spend some time relaxing your hands and doing a little bit of a check for any contraindications we've got. And then what I'd like to do is just explore a new learning tool I've got for hand reflexology. And we will look at that in a moment and explore that and see if we find it useful in terms of a new learning tool. And if it is, we'll take it further and do a treatment with it and see how we get on with that. Okay, could I just ask you first of all just to move your jumper just up, the sleeves up slightly? That's great, thank you. Okay, so what I'm going to start with, I think, is just talking to you a little bit about your hands at the moment. And obviously we use our hands all the time. Hands hold a lot of stress, and any form of relaxation treatment on them is going to be helpful for our overall well-being. Do you use your hands a lot at the moment?
I use them to kind of type, I guess.
Right, okay, so PC usage, tablets, things like that. Okay, so what I might do then is just do a little bit of relaxation before we go into that. So let's try a few gentle moves on that. So I'm going to start with this one, and in particular because you're using your wrists quite a lot, I think we'll just give them a little bit of a gentle massage, and on the other side as well. And then if you could just sort of hold my hand there and we'll check just the movement there. Yep, that's absolutely fine. And then I'm just going to hold the hand there and I'm just going to rock the wrist slightly. Just gives a little bit of a movement in there, helps you relax that hand. That's fine. Then I'm just going to gently massage these fingers out. Then just a little bit of a stretch in this palm. Okay, so if we just pop that one down. Are you okay there on, or would you like a towel underneath there?
No,
Yeah, okay, all right. Okay. We're going to do the same on this side. Okay, if you pop that elbow up. It's just to help you relax. Okay. Just do that palmar stretch while I've got your hand up like this. And then we'll just gently massage these just to get rid of some of the stress. Right, okay. And while I've got this hand here, I'm just going to put the magnifying glass over this and just check for any contraindications while I've got your hands here. Okay, just got a little scratch here. I don't know if you can remember where that's from.
I'm not really sure where it's
Okay,
from.
that's fine. It's not open or exposed, so you know it's not going to interfere with a treatment at all. A little patch of dry skin here, which I think we've come across before. So what we might do towards the end of the treatment is have a look at that again and see what we can do. Let's just turn this over, see if there's anything on any of these fingers. No, I think we're all okay with that hand, so just relax that there. Let's just check on this one. Yeah, no dry skin there either. Okay. That's absolutely fine. I'm just going to have a quick look at nails while I've got your hands here. No, that's absolutely fine. So what we're going to do today is something a little bit unusual. This is not a learning tool I've used before, but I've used something very similar for the feet, but not for the hands. And I came across these and thought they were such a good idea. So let me just show them to you. These are gloves, which are let's do the left and right. And this is really to help you understand where some of the main reflexology points are. But with you wearing the glove, you can actually see. It makes it just easier for you to do some self-massage. There's self-massage in terms of self-reflexology. So having the gloves there means that you can guide yourself. So you put the gloves on and you literally just follow that. The one thing that you might need to look up is some of the reflexology techniques if you want to do this yourself, or you're doing it on your partner maybe. You may just want to look something up in terms of some of the techniques, and I will show you some of them today. So the next thing is to actually get you to pop these gloves on, and we'll do one hand at a time. What I've got to help us, because this is a new tool, it's not a learning tool I've used before, I've got my reference manual that I use for reflexology with some very visuals to help really understand that. So if I'm not quite sure, and this doesn't depict what I understand where the reflex points are on the hand, I've got a backup reference tool, and that's something useful to have just there. You're thinking, not too sure where this should be. So having this here as a reference point for you to back up that information is always handy, especially if you can find something that's quite visual. We're only going to look at the plantar view. There is a dorsal view for this as well, which is the top of the hand, but we're only going to look today at the plantar view. But if you wanted to and explore it further, you could look at the dorsal view. And unfortunately, these gloves don't have that.
Okay.
Maybe there's a niche in the market to invent some reflexology gloves as a learning tool that have both sides on. So should we start with the left hand and we'll put the right hand to that. So you're putting it on like that. Yep, in like that.
Oh, I see.
Yeah.
Yes. Upwards like this.
Yeah. So if you can see on the picture, it's mirroring that.
Yeah.
Yeah. So that makes it nice and easy.
Okay.
And what's good about this is, you can literally just follow that. And if you were doing it yourself, you could see how straightforward that would be. So we're just going to follow this round. Now, obviously it's difficult for me to do this, so I'm going to do my best, but normally when you're treating you would be going up this way, but I'm just going to point to where some of these things are. Try and resist the temptation to do all the various moves, but I might just show you some. So for example, the spine, which actually goes up the side, you can see it in the reference book here on the blue there. So you would do something like this little caterpillar move, go up the side of the thumb there. So at the top of the thumb here, you've got the sinuses. Then you've got the head that you would massage, the neck, the thyroid there. You've got the stomach just inside. Then along here, you've got the eye and the ear. Now you can see, funny enough, it is a little bit different on this one actually, where you've got the eye and the ear slightly higher up on my reference book. So I think you can just massage the whole finger there. And then the sinuses, you can see, are in all of these fingers. So you would massage those all down with your little caterpillar move there. And the eye and the ear we've done. And here you've got the lungs. Here you've got the shoulder. There you've got the heart area there that you could go across like this. Got the spleen down here. And then the solar plexus that you would do a sort of hook move, a little bit of pressure in there. Then you've got the kidneys going down to the bladder, and I think on this one here we've got that is actually the ureter tube there. And then you've got the colon, which you would massage that way. You've got the small intestine behind that you would massage over. And then here I think they've put together the genital glands. Okay, so on my reference point it's got the uterus or prostate going over to the fallopian tube, going over to the ovary and testes. It's a little bit more detail on my reference point there, but basically you would go across that. So I think it's useful to have that tool as a reference point just while you're learning. And then obviously once you've got the hang of where everything is, you would just take the glove off, and then the techniques which I've suggested you look up, because there are a few of them, you would then apply those. But you could do it from this way up on yourself. So for example, if you did the spine, you could go up like this in that, using that caterpillar move. The solar plexus, you could go in and do a hook move like that. So it just works, actually. It's quite useful. So probably getting a little bit hot in there.
Yeah, they're actually quite cozy. Yeah, it felt really nice
like
when the touching and the pressure.
Oh, okay, that's useful to know, actually. Maybe we'll get you to do it on me one day. Okay. So I think we're okay on this. And then, as I said, well, maybe at the end I'll turn the page over and you can have a look at the dorsal view as well briefly. But if we take these off so you don't get too hot, and we'll just do the same. If you switch over and do the same, they do feel quite nice and silky, don't they?
As well.
Yeah. Mind you, you've got delicate hands, which is why sometimes, or petite hands, which is sometimes why it pulls. Obviously with somebody with slightly larger hands, it would fit them like a glove. Okay, so let's just cover this area as well. I'm looking at the reference one here. I want to really look at this. So spine up here again, sinuses. I've got the word printed here, and as I said, the reference again, slightly higher up. Head, neck, thyroid, stomach area here, kidney, and that's the ureter tube, isn't it? Yeah, going down towards the bladder. And then you would work the colon there, move across the small intestine there. Got that solar plexus where you would do that hook move in there. You've got the lungs that you would work across. So this is the colon here, and then behind that would be the small intestine. Then at the bottom here we have got, we've grouped, as I said, the genitalia together along the fallopian tube at the bottom of the hand there as well. That takes us back to the shoulder here, shoulder area. And actually I think on mine it's got the armpit there as well, the lungs and the liver area. And then, oh yeah, we've done the ear and the eye because we've said on the reference point it's a little bit higher there. Okay, so all of the basics there. That's useful. Matches up reasonably well with this. Obviously you can get a clearer idea from this of how big the intestines are, because this is huge here. Probably a very small area there, although they have got the colon within that, so you'll be working the colon as well. Yeah, so I would tend to work over that whole area, both horizontally and then vertically, and sometimes even diagonally, so that you cover all of those parts in there, and then pick out some of these key areas with some of those other techniques. That said, my advice would definitely be to, if you're going to do this yourself, a little bit of research around the different techniques. Okay, so should we take this off? There we go. And what I wanted to do was just show you the dorsal view here. And you can see it has very similar areas, but just on the top of the hand there. So there's nothing that we're missing out. It's just you've got to imagine that it's following around to the other side. And in many instances, you would be working underneath and on top anyway. So you would already be there on that. Okay, how does that feel?
Good, it's fun.
It's a different learning tool, isn't it? So I quite like that, to get some of the key ones in there. Obviously, with reflexology, it's a complementary therapy, so it is alongside, or to be used alongside other treatments that maybe you're using with your doctor. So the evidence for reflexology is quite anecdotal. There are some research activities going on, but the huge bulk of the research for reflexology is still anecdotal, but very heavily anecdotal as well. And that anecdotal versus scientific will carry on for years to come, until a lot more funding is put into looking at the research. But definitely, so if you can use this as a tool to help you relax, you or your partner, and use that to help you find these reflex points, and it works for you as part of your well-being, then that's good. Okay, thank you for your time. I have some lovely feet that I'm going to be practicing on and focusing on the reflex points by tracing those points with my wonderful reflexology tool. Just really looking at all of the key reflex points on the feet, and I'm going to be using one of my old textbooks to help and guide me, and literally we will go through that in detail, looking at each reflex point on, first of all, the left plantar view, and then we're actually going to do the left dorsal view on the top, and then we'll move to the right plantar view on this foot, and then move to the dorsal view of this foot on the top afterwards. So what I'm going to do first is just cleanse the feet. It's just in case your clients picked up anything untoward on their feet. And it's actually quite cooling as well. So I'm just going to get another wipe to cleanse the other one, so that if you touch it while you're working, then everything's nice and clean and hygienic. Obviously, it's important that before you start on the client that you've washed your hands, which I did earlier, for hygiene purposes. Okay, and now we're all ready to start. So I'm just going to do a few massage moves. Now, obviously, if you were doing a proper reflex massage, you would probably at this stage use a cream or something that just provided a little bit of massage medium, but because we're not going to do a treatment today, we're actually doing tracing, we don't need to add a medium. Okay, so we're ready to get started, and as I said, I'm going to use my reference point here. So I'm literally just going to follow around the words that are set up here. Right, okay, we're going to start with this left plantar view, and because sometimes occasionally the pictures in the textbooks can be confusing, you almost need a point to locate your start from, and some people start at the bottom and go upwards, but I actually find it easier, especially when you're just tracing, to start with the big toe and work your way around the foot. So if we start with the big toe here, at the top here you've got the brain, then you come down to the hypothalamus, then the pituitary, then at the side here you've got the nose, then the throat here, then you've got the neck and thyroid just under those first three toes there, then the seventh cervical vertebrae here. Actually, the spine runs all the way down. But you can use the seventh cervical or cervical vertebrae here, just to give yourself a location point. Then as you come down, you've got the thymus here, and then the heart. And then another good location point is the diaphragm coming across here, which allows you to find your location point again. Then we have the liver, it's there, and then the solar plexus, a key area of reflexology, your energy centre there. Then moving down, you have the adrenal glands here, and then just underneath that, slightly kidney shaped, is the kidneys there. Then we've got the pancreas underneath that. Then the ureter tubes going down into the bladder and the rectum here. Then we've got a little bit further down, we have the pelvis buttock area on the edge here. Then we have the sciatic nerve. And then this very large area at the bottom here, we have the pelvis. Then just about here, we have, looking at my reference point here, we've got the sigmoid colon. And then going upwards, we've got actually the descending colon. Then just to the left of that, we have the rather large small intestine area. And then obviously going up from the descending colon, we've got the transverse colon going across. Then the spleen. Then across here we've got, going upwards, just in here, the axilla, which is the armpit, going up into the shoulder area. Then we have the sinus areas in the toes. Then we have the ear first, ear on this toe here. We have the eye here. Then on these three here, we have the side of the neck, and then the brain, and then the brain here takes us back to where we started previously at the beginning. And that's the plantar view of this left foot completed. Okay, so we're just going to start with tracing the areas on the dorsal view of this left foot. So we're going to again use my reference manual. So we're going to start at the top, and we're going to start with the cranial nerve, which is, this is where you would work along here. And we've got the teeth running along these first three toes here. We've got the face in this area. We've got the neck and thyroid running along here. We've got the lung and breast area here, and obviously behind that you've got the ribs, this very large area here. Then towards the base of the foot there, we've got the fallopian tube running over that. And then just on the other side here, you've got the trachea and bronchi, and then that takes us back up towards that cranial nerve area. And that is that foot complete with all of those reference points located. So I'm just going to focus on the other foot now. So if we can move that foot out of the way, thank you. Okay, so I'm just going to loosen this up slightly. Just give that a few moves just to relax the feet. There we go. And then we're back to the plantar view. So again, I'm going to use my reference point to start with as the big toe. As I mentioned, some people start at the bottom here, but just for the tracing purposes, I simply find it easier to use the big toe as a locator, particularly when you're looking at some of these diagrams. When you start at the bottom, it just gets very confusing. So I'm going to start at the top again here, which is the brain, coming down to the hypothalamus, the pituitary gland, the nose along here, the throat here, the neck and thyroid along here, the 7th cervical area, which is here, then this very large area here, which is the lungs, then the thymus, the heart, the diaphragm, which is also, when you're treating, a good place to always have as a locating tool, going across there. Then a little bit further down is the liver, and underneath that is the kidney area, the pancreas to the side of that, the ureter tubes coming down towards the bladder and the rectum area, the sciatic nerve going across the bottom here, then this large area at the bottom here, which is the pelvis area, then coming up this side, just above the pelvis buttocks area, is the iliocacial valve, then the ascending colon, which goes into the transverse colon, and then just inside from there you've got that large area there, which is the small intestine. Then next you've got the gallbladder, which sits within the liver area here, and then that takes us back to that good location point, which is the diaphragm. Then here on the side you've got the axilla, the armpit area, the shoulder, then coming up to the sinuses, going across all the feet. Then you've got the ear and the eye, the side of the neck, which is a really useful one to work. That's where people get quite a lot of pain, and it's often good to relax and work the sides of the toes. You would do that like that. And then you've got the brain area on the top of the toes here, which you would actually use a different move. You would use a pressing move, and that takes you back to your big toe. Okay, so that finishes the plantar view. Then we're going to move to the top of this foot so we get the dorsal view. And again, I'm going to use the big toe as my locator point. So we've got the cranial nerve going down here. We've got the teeth worked across this area. We've got the face on this area here. Then going down, we've got the trachea and bronchi. Then we've got this very large area here on the top of the foot, which is the lung and the breast area. And obviously behind that, you would have the ribs. Then towards the bottom here, you've got the fallopian tube, one side to the other, which joins up where you were working on the back, on the bottom of the foot, and that would join up with your treatment on the underside as well. And that then takes you back up to the main big toe, taking you back up to the cranial nerve. And that completes the dorsal view on this side. So if I could have your other foot back, so that completes the tracing of the plantar area of the feet and the dorsal area. So that locates all of the reflex points across the whole foot, and you would use your various techniques to work both feet. You can either do a foot singly or you can work them together, and there are some areas that cross over from one foot into the other that you would work as well. So thank you for lending me your feet and for helping me get those reflex points as part of my study and relearning, working towards finally getting back to doing full reflexology treatment. And thank you once again for helping me relearn hand reflexology. And what I'd like to do today is really get a visual of some of the reflex points in the hands. And in order to do that, what I'd like to do is use a reference manual with some colourful pictures and really enable me to use that to pinpoint some of the key reflex points in the hands. And that way we can ultimately lead to a reflex treatment. But I'm not feeling confident enough yet to do a full hand reflexology treatment. I feel I just need one more session on tracing these reflex points to get them in my head. So this is one of my useful books that I use, a step-by-step guide to reflexology, which is proving quite useful. And they've got some very visual hand reflexology reference maps, and that's what I'm going to use today. When you first look at this, you have to look at it this way so that you actually understand the positioning of it. So the best way is just to take it one hand at a time, and this is what we call the plantar view, which is the inside palm area. And as you can see here, it's going to be quite awkward because if you look at it this way,
yes, that's this one.
Yeah, and that's this one. So in my head, I've got to obviously transpose slightly. I'm having real difficulty finding a better learning tool. Maybe there's a niche in the market for learning tools on hand reflexology. So what we are going to do is work our way round this, transposing as we go along, and focus, as I said, on one hand first. So if it's possible for you to put that hand, relax that hand, and we're going to focus on this left plantar view to start with, and we'll see how we get on. Okay, so I'm literally just going to follow the words around and point to the area, and that hopefully will sit in my brain that much better, so that when I come to do the actual treatment, I'll automatically know where these reflex points are, and really take full advantage then of this treatment, so that I can help to relax my clients through the use of hand reflexology, particularly useful for those that are unable to do foot reflexology, for example, those that are not well or have problems with their feet. It does still enable them to benefit from reflexology by doing it on the hand. But you've just got to become familiar with where all these reflex points actually are. So we're going to start over here, which is with the ovaries. We're going to follow the fallopian tube over to this side where we have the uterus. Then we're going to follow the spinal cord, the base of it here, and take it all the way along the side of the thumb here to the top area of the spinal cord. And then we're going to go inwards here, And then we're going to use our reference point to go slightly in and find the bladder here. And then we've got the ureter tube going up to the adrenal glands. Okay, and then at the base of the thumb here, we've got the neck and the thyroid gland there. Then further in, we've got that's much further up. Okay, so let's try and find the pancreas and stomach area. So we're going much further up here. So we've got the pancreas and the larger stomach area around here. And then going up, we've got just on the tip of the thumb here, we've got the brain, the pituitary and the pineal gland there. And then further down the thumb, we've got one of the sinus areas here, which are also on the bottom area of these fingers and the top of this one here. And then slightly below that sinus area, we've got the ears, slightly below that. And then at the very top there, we've got the brain continuing at the very tips of the fingers there. And then going on to this smaller finger, we've got the shoulder in the top part of this. And obviously with people with shoulder aches and pains, these are the areas that you would work. You've got what we call the axilla here, which is the armpit area, just around this area. And then going all the way across here, we've got the diaphragm. Then coming along quite a large area there is the spleen. And then going in to that area, we've got the sigmoid. Slightly on the side here, we've got the hip and pelvis area and the coccyx area at the bottom of that as well. And then that takes us back to the base of the spinal area. So that is the plantar view of the hand done. Actually, that seems a lot more simple than I thought it was going to be. I think when you first look at the diagram, actually the visuals are helping, the colours are helping on this, which I think is useful, and having it this way actually helps as well. So that's actually very helpful to me, and I think I'd be confident in doing a treatment much more than I was previously, so thank you for that. So we're going to swap over hands, and we're now going to look at this one. So again, we're going to start on the side with the thumb, and again we're going to start with the ovary here and moving across the lymphs and the fallopian tube along here to the uterus on this side, and then we're going to do the base of the spine, going up the thumb to the top of the spine, and then we'll go I don't know what to do here. How did I do it there so simply, and I'm struggling with this side. What did I do? I did that and then I went up that way. What am I doing differently? That's making it so complicated. Maybe I need to go that way round. Do these words that way round. So we need to start here. Sorry, we're going to have to start again on that one.
It's okay. It's quite informative. I'm learning a lot.
So I need to do it that way round.
Mm-hmm.
Okay. Right. So where we've got the uterus here, We then come upwards, and then if I can just open your palm slightly there, you've got the bladder there, the ureter coming up, and the adrenal glands and the kidney there. Then at the base of the thumb, this is much better. You've literally got to go that way around. The neck and thyroid gland there, and then at the top we've got the brain, the pituitary and the pineal gland there, and again the sinuses here. Where are those other sinuses? These here, and slightly higher up here. Then we've got the ears coming across these first two fingers here. We've got the brain at the top of those as well, following on from the brain at the thumb, going across to these two. Then coming back to the smaller finger here, we've got the shoulder area. Then just here we've got that axilla armpit. Then the diaphragm going across there. And we've only got the liver on this side, because on the other side we had something else as well. So we've got the liver there. Diaphragm, liver, intestines, all the way, that huge area that they've got all the way across. So you've got the intestines bundled into that area. And at the bottom down here you've got that ileocacal valve. Then at the side here you've got the hip and pelvis area. Then back down to that base of the spinal area, finishing up there across the base of the spine, and that takes you back to the ovary here and the fallopian tube and the uterus. Okay, got there eventually. That was a bit harder, but once you get in your head that you're actually, if you're following the words that are spelt out here and going around that way, that makes it a little bit clearer. Okay, so that completes the tracing of the plantar view for, first of all, the left hand palmar view, plantar view, or palmar view sometimes referred to, and the right side as well. Only very few differences there. Okay, so let's move on the reference book onto the dorsal view. So again, I'm going to have to put it a little bit nearer so that I can actually read it. Okay, so if I can have your hands, and I'll map those to this. This is the dorsal view, so looking down on the top of your hands. So let's start with the left dorsal view. So if you could pop that down, that would be helpful. And we should just be able, I can get this a little bit closer so that I can read it. We should do similar to what we did on the previous page, literally just follow this round. So if we do that, and then we'll do the other way on that, I think that will make it easier. So again, we're going to start here with following the diagram of the finger down. So we'll start with the ovaries, which is here, moving across the lymph and fallopian tubes, across to the uterus here. And then we've got the pelvis, hip and sciatic nerve. So if I can just turn yours is slightly to the side. Okay, that makes sense. Then the next part, we've got the knee and elbow in this area here. And then back here, we've got this huge area that they're referring to here, which is the stomach area, which goes huge. It's right the way across here. So you would work that whole area with some of your thumb moves. Okay. And then after the stomach, we've got the diaphragm area coming right across underneath all of the fingers. That's the diaphragm area there. And then going back, this whole area here is the edge of the shoulder. Okay, and then this top part here, you've got the lung, breast, ribs and heart sitting in there. That sort of makes sense, doesn't it? And actually I think that stomach and pancreas area is a little bit further down. Right, we'll have to watch that one. And then we've done the shoulder area. The next one here is the sinuses. So we've got the sinuses here and in the lower part here and the thumb as well. We've got the other side of the ear on this one, this one, this one. And if you're wondering why they're on both sides, it's when you're massaging on reflex, you'll be doing the underside and this side at the same time. So if it looks like you would think, okay, haven't we already done the ears? But when you're doing the hand, you could do it like that. So you're actually covering both at the same time. So that's useful. And then coming down on the thumb part here to the thyroid gland there, and then that takes us back to the uterus, just there. Okay, that's quite straightforward, I think. So that's much clearer than the first time I attempted it a while ago. Okay, so the dorsal view of the right hand. So we'll do this, but we will go that way round, which I think will get it more firmly into my head. So if we start here at the ovaries, go across the lymph and fallopian tube to the uterus, and then we've got the pelvis, hip and sciatic nerve in this area here. We've got the knee and the elbow up here. We've got the liver, let's get this right because we've got the lungs to fit in there. So liver is down this area here. So what they've got here, yeah. Then the diaphragm going across. Okay, and while we're here, the lung and the breast area, because that's that part there, that's that larger part. And then the shoulder area there. Then we've got the sinuses, we have got up here and then here. Okay, I'm just going to redo those sinuses because I'm not sure I got them in the right place there. So sinuses here, yeah, here, here, and that's what I missed out. So we've missed out the thumb on the sinuses, which is there as well. So we just go back and pop those eyes in. Let's just redo that one. So it's actually, this is the ear and this is the eye. Okay, so we need to remember that. And then just to finish off, we've got the thyroid gland across the thumb, the base of the thumb here. And then that takes us back to the ovaries. And then I think we have covered everything. Just got a little bit muddled there, so I'm going to go back and refresh that in my head. And then I think we might be ready to attempt a treatment.
Sounds good.
You're learning lots about reflexology in the body.
It's really fascinating tracing it out on the cam.
It is fascinating the way that when you look at this, you can actually see the body, and obviously the reflex points. If there are some amazing pictures where it's almost got the body in there, we'll have to find one. And then obviously taking the zones up through the body, and really helping it. But to be honest, just the reflex activity on the hand just is part of that overall relaxation and approach to well-being, which you know I love. But this has been one of the most challenging treatments to get back into my head, I think. But we're getting there, definitely. And we'll be doing some hand reflexology treatments very soon. So thank you very much again for the loan of your hands. I've got a little bit of a slightly different approach to me learning the reflex points on the feet. I've discovered these wonderful learning tools. So socks with the key reflex points placed on them. So I've decided I'm going to have a little bit of fun and use these. I've also got my backup reference point here, which is my old reference textbook, if I need to refer to that, which has very clear images of the plantar view of the feet. And it'd be interesting to see how they match with what I found with this really, which looks like quite a useful learning tool. I've not come across these before, but they look quite interesting. So I'm going to use it to really help me relearn these reflex points on the plantar view of the feet. Before we start, I'm just going to do a brief introduction to what reflexology is about. Reflexology is both a simple science and a safe and highly effective way of treating the body without the use of drugs or surgery. All that we need to be highly efficient in applying this science is 2 hands and the knowledge that you gain through professional study. Reflexology is a method for activating the healing powers of the body. By applying pressure to specific points in the feet, we can create a stimulation through the nerve pathways from the feet to the brain, similar to the principle of acupressure, where needles are positioned through the meridian lines, which stimulate an energy or nerve impulse through the entire system that encourages the body's own healing potential. Every part of the hands and feet correspond to a specific part of the body. So by applying pressure to the reflex points, it is possible to treat the different areas of the body. Reflexology relieves tension and gives the receiver a wonderful sense of well-being. It therefore can be used confidently in treating most of the everyday problems that we might consult our GP with. For example, things like migraine, sinus conditions, kidney problems, menstrual difficulties, some depression, ear, nose and throat conditions, as well as being extremely effective in treating all forms of back conditions. There are so many benefits to be gained from reflexology for both the patient and the practitioner. Very few of us perform at our best if we're sluggish or tired. A session of reflexology often has the effect of a pick-me-up. It can make you feel more positive and good about yourself. Reflexology, however, is not a cure and should not be professed to be one. Reflexologists do not diagnose illness, nor do they practice medicine. And now I'd like to start going through using this new learning tool, which if you have a volunteer, like I do here, they can literally put the sock onto their feet, and then this will identify the reflex points for you. So for example, you've got your heart here to start with, and obviously once you learn your reflexology techniques, you can actually work these areas, but I'll do this now. But if you're looking into doing this yourself, what you need to do is do a little bit of research on the techniques, but this is a common one that we use, which is called the caterpillar technique. So you would literally caterpillar over that heart area there. Then you have the pituitary gland here, clearly labelled in a colour, which is really helpful. And you can go across that. Then you've got the thyroid underneath there. And then you've got the heart area located here as well. So you would work that whole area there. And then you can see, if you look at this, they've sort of got the sinus area marked along the top. In fact, there is one on this toe as well, but they've got the sinus area marked there, and you would work these. Slightly different technique on these as well. And in some cases you would actually come down the foot using that technique. Then on this here you've got the eye and the ear. Actually, on my reference point here, it is slightly higher, but if you're massaging that downwards, you would massage, you would cover that area. But they've got the eye and the ear here. Then you've got the bronchial tract going up there, covering over the lung areas here. It's actually very helpful because it does stop you, because you can now just focus on that lung area and then go into the shoulder area here. Then you've got this wonderful diaphragm line, which is a very good point of reference. Then you've got this area here, which is your key energy centre, the solar plexus. You wouldn't actually work over that, you'd actually push fairly hard. So you've got like a hook method going into there. Sometimes when you press on that, you can actually feel a slight hardness, and you can release that. Then you've got the stomach area, which actually comes down a bit. So massaging that round with the adrenal gland here, the spleen over here, the kidneys just underneath those adrenal glands, and the urinary tract going down into the bladder here, the small intestine over that area, the sigmoid colon going down here into the rectum here, and then you've got the heel line and the sciatic nerve, which actually goes right the way across there. And that covers all of the areas that they've identified there. Very useful, just as key point areas. I think this is a really useful starting point, but I do think you need a backup reference point to make sure you're covering the right areas in the right location. And then you also would need to research or revise, if you've learnt this already, which particular techniques you would use for which part of the foot. So that covers nicely that left plantar view, and very clearly covers that. I will just point out a few areas that are missing. So the brain, which is worked on the top here, is missing, and the spinal area needs to be included as well. But to get you started and thinking about where the reflex points are, it's a useful starter tool. Okay, so we've done that left foot. So what I'd like to do is just move over to the right foot. Oh, thank you. Okay, so again, we've got the heart area here, and you would use your thumb caterpillar moves, and actually you might want to come down as well to cover that area. Then you've got the pituitary gland here and the thyroid, and then they've got the heart area there that you would work along. Here you've got the bronchial tract, which you would work along. And they've got the sinuses here, which you could work on. And then underneath that, I think it's actually here, but they've got it lower down here, which is the eye and the ear. It's actually on the toes, I think, in most reference points, but their reference points has it here. Then underneath that eye area, you've got the large lung areas along here. And then over towards the side of the lungs there, you've got the shoulders that you would work. You'd actually work right on the side of the foot here as well, actually. Then you've got your diaphragm reference point along here. And then on this side, you've got your gallbladder, which you would work on there. With the liver running behind that. So once you've done the solar plexus, you would work on the liver to cover that whole area. Then you've got the adrenal glands here, just above the kidney area. And then the urinary tract, which then takes you down to the bladder. Then here you've got the large intestine, the small intestine, which is always makes me chuckle because it's actually a really big area. You've got the ileocacal valve on the side here. Then you've got the heel line going across, and also the sciatic nerve going along there that you would massage across. And a few key areas that are missing on here are the brain on the top of these toes here, and the spinal area, which is all the way down, and you would massage that in one go. And swap hands at some point so that you could go across where the sciatic nerve runs across. But a useful starting tool which gives you the key areas for some of the reflex points for the plantar view of this right foot. So one thing I do find with these socks, they're very helpful as a learning tool, but one of the areas it doesn't cover is actually the top of the foot, so the dorsal view. So what I'd like to do is use one of my normal reference points and just cover some of the key points that you have on the dorsal view. So we're just going to cover the right dorsal view. So let's go down. So you have the cranial nerve here. You have the teeth that you would massage along with your caterpillar move. Or for some of these, you could do a squeezing, pinching move as well to make sure you get right in. Sometimes with small toes, you have to slightly adapt your technique to actually get in and ensure that you cover everything. So that's the teeth area there. And then you've got the trachea and bronchi that you would work just on the side here. And then you've got the huge area here, which is the lung and breast area that you would work over. So that would be your lung and breast area. And actually behind that, you've actually got the ribs as well. So by doing the whole area, you would cover the ribs as well there. Then at the bottom here, you've got the fallopian tube. And then just coming up, covering the remaining areas, you've got the neck and thyroid along the base of these 3 toes that you would cover. And then also the face area is covered here as well. So whatever works, depending on the size of the toes, you could work the facial areas there with various techniques. Really depends on the individuals as to which techniques you would use to get in to some of these areas. And even the side of the neck, which is down here, you might have to vary your techniques to actually get in and do those. If we can swap and I can have the other foot, thank you. I'm just going to pop that one out the way because I'd like to do the dorsal view on this left foot as well. So just running through as we did then, starting with the big toe again. So we've got the cranial nerve along here, those teeth that we would work along, or you could be doing that move as well if you can reach in sufficiently, and the face area which you would massage through. And then you would come down underneath to do the trachea and the bronchi. Then along here you've got the neck and the thyroid along there. Then you've got this large area here, which is the lung and the breast again, and behind it, that large area of the ribs underneath that. And you would spend quite some time working these areas. With your various moves, whatever works. Particularly working out any build-up of tension in that area. Moving back down to the fallopian tube and making sure that that is worked and then connects to the plantar view of the foot as well. And that actually covers the dorsal view, and I think it would have been helpful if they'd had that actually on the top of the socks. I'm sure there may be a learning tool out there that covers that, but actually just having this reference point, this is a very good reference book, and the diagram is very clear on there as to where these reference points are on the top. So just finishing off, I think that covers nicely both the plantar view, which you've got these helpful points by using this other learning tool that I've discovered with these socks, and then maybe just adding in that dorsal view to make sure that you've got all of the relevant reflex points. And once you've got to grips with that, obviously then revise your techniques, and then you should be ready to start doing a treatment. Thank you for loaning me your feet. Hello, Melissa.
Hello.
Thank you so much for agreeing to be a model for me today. I just have your hands out, thank you. Would you mind just taking your sleeves up slightly? So one of the things I'm going to focus on today is relearning a treatment that I did many years ago, which was hand reflexology. And even at the time when I learnt it, it was a treatment that I found quite challenging. It's very precise, lots of things to learn, quite a lot of moves. And one of the first things you've got to learn is where all the reflex points are on the hands. Very similar to what you helped me with the foot reflexology, which really helped that get into my head again. But these, it's quite challenging to do hand reflexology, simply because there's quite a lot to relearn. So what I'd like to do today is literally do some mapping of the hands. And one of the things that is very challenging with this is when you go to look at maps of the hands on the charts in textbooks, they do sometimes reflect a confusion, because some people look at the hands this way and some people look at the hands this way, and it can make it very confusing depending on what you're doing. So bear that in mind if you're trying to look at a chart or you're trying to do self-reflexology, which is a very good treatment as well. And today I've got a picture of, we'll start off with the palms, a picture showing the palms. And you can see here the thumbs are together, so it is confusing.
Like that, I guess.
Yeah, which is really confusing. So what we're going to do is just focus on one palm at the time, but I thought it was good to explain to people the confusion. And then we're going to turn over and do the dorsal side as well. So we're going to start with the right palm, and we're going to literally map this. But first of all, do you know much about hand reflexology at all?
I really don't know much. I actually thought originally the word reflexology just meant the feet.
Oh, yeah.
I didn't realise there was so much else that came with it.
And people don't. It's not common knowledge that actually you can do reflex on the hand and even the ear as well, which is maybe something to look at another time. But definitely with the hand reflexology, there is a belief that it does map the body. And going back to our good old zone therapy that I went through when we looked at foot reflexology, the hand maps the zones going through the body, and the idea is that you do particular moves which stimulate the zones within the body to try and get the body to kickstart and heal itself along those zones. Very interesting, very fascinating to read. And it is part of the approach to wellness and well-being. And also, it's just nice to have a treatment. It's nice to have that touch. And having these sorts of treatments can be part of that, having that little bit of me time. I think there's a lot in there. There's a lot of anecdotal evidence to support the fact that it does help the body to heal itself, to kickstart those endorphins. Obviously, the scientific side is a little bit weak still, and the evidence is lacking to support some of the claims that are made. So, you know, we stick with anecdotal evidence. People do feel that pressing on certain parts of the hands that correspond with these zones do stimulate that area and the signals along the spinal cord up to what we call the thalamus gland in the brain, which then produces endorphins. So again, leading to the body trying to stimulate and heal itself. And that's really what the ancient Chinese and Egyptians believed in pressing. There's hieroglyphics that reflect their belief that these reflex points really made a difference. So we'll have a look at that. I know, I just find the whole thing quite fascinating. I'm really thoroughly enjoying getting back in and investigating all this. But as I said to you, I found this one quite challenging. So what we'll do is we're going to follow this wonderful diagram. So useful to have it on an iPad, quite colourful, very clear. One of the reasons I like this picture is it just takes you through step by step what each area claims to link to in terms of the body. Right, what I'd like to do, I have got some 2 old tools that I still have from my treatment days, and one is metal, one is a slightly more old-fashioned traditional one, which is wooden. The wooden one is more used for actually pushing and pressing the areas, but I'm going to use this metal one today as more of a pointer on the bits of the hand that reflect these reflex points. And obviously what I used to be asked, and I'm sure it might be something that you've thought about as well, is why the hands instead of the feet? Yeah. And actually it's just a personal preference. They're equally thought of in the reflexology world as suitable to use these reflex points. And actually the hand is accessible. You know, if somebody's ill or you can't get to their feet, the hand is a really good alternative massage to use. So are you ready to help me on this one? Because as I said, so many points to look at. So let's see if we can do it that way. So number 1, okay, and you can see here it's very clear. I don't know if you can see this chart. It is helpful. I just wish they'd put the pictures the other way around, but let's just focus on that right palm, and you can see it's got the number 1s at the top here, and this is where you've got the brain and the sinuses, so all these areas here. And obviously what you would do is with your reflex moves you would press down, and this takes quite a lot of practice. I remember when I was learning reflex, it was the longest one to learn because you had to keep practicing the moves, because some of the feelings that you get, that you recognise as a reflexology, take practice. The feelings under the skin are really subtle, and sometimes actually your client can feel elements of pain and discomfort, and sometimes it feels like a bruise, and that's where you've got a blockage, and that's something that takes practice to work on. So I'm starting very slowly, getting to know all the points, and then step by step I'll move towards full treatments, but I'm not there yet. hence the reason I'm using you to practice on. So number 2 here is the outer ear, and this is a strange one because it's in here, in between these fingers. And I don't know if you remember the ones we did on the feet, but it was similar to the feet. Very fascinating. And then number 3 here is actually the inner ear. I'm just tracing that there. And then number 4 is the eye, just these areas here. And obviously you would use specific reflex moves to really get in there with your fingers and go like this and massage those areas out to get the reflex points working. Right, the next one is very unusual. It's number 5 and it's called the pineal gland, and it's literally on the side of the thumb here. So just point to that and get that back in my head as well. And then number 6 is all the way in. I might have to show it on my thumb here so that you can see it. And that's the pituitary there. Then we go number 7 to the shoulder, which is over here, which is this part. And you would do a slightly different reflex move there. That's like a sort of walking move. And I can feel that just with doing that. Yeah.
Feels nice.
It does, but you'll probably feel it in your shoulder. When we do a full treatment and I'm treating you properly, then you'll feel it in your shoulder or your arm there. And then number 8 is the neck, which is all around this area here, almost on the inside and the bottom of your thumb. And then number 9 is this area here. So we're going from here all the way along there. Quite a large area to work when we actually have to work it. And then 10 is the heart, just underneath the thumb, at the very bottom of the thumb there. And then the spine, which is 11. Okay, so that's all the way down here, the spine area. You remember that's actually quite difficult because there's a number of different parts of the spine, but this is the main spine here. Okay, and the diaphragm, which is underneath the heart. You can almost see this because there's a line there, if you can see. That's where the diaphragm sits. Right, so after the diaphragm, we've got the solar plexus, which is this point right in the middle here, which harnesses a lot of energy and often needs clearing. So that's a really good point. And I won't be able to pinpoint that directly until I start doing a proper treatment, and then I'll be able to feel it. You can actually feel it when you're doing it, but just pointing to it, we're not going to feel it. I need to press quite deeply on that one. And then 14 is this huge area here, which is the liver, which is great. And within the liver, you've got down from the second finger is the gallbladder, which is just there. Okay, then we've got 16, which is the stomach area, and it's quite small on the right palm. There's a bigger section on the left palm, but we'll get to that when we look at the left palm. But there's a small part because the stomach goes over, obviously, towards one side of your body, and that's reflected on your hands, the fact that it is going across both areas. And although 17 would be the spleen. It's actually only on the left palm, it's not on the right palm. Then we've got 18, which is the adrenal glands, which you have on each palm, which is just about here. And then we've got 19, which we'll cover later because that's on the left palm. Okay, so number 20 is the kidneys, which you have just here. And then you have what we call the ureter going down, 21. And then 22 is the stomach area towards the side here, on both sides, obviously. And then we have the duodenum, which is just above that area, just above that area there. So 24 is the small intestine, which covers this quite large area here. And then you have the large intestine, which actually goes underneath that and right the way along, coming down along that up to about halfway there. So after the large intestine and colon, 26 is something called the cranial nerves, and that literally follows all of the edges of all of the fingers, and these are all your cranial nerves going all the way around. And that's finishing the right palm, so thank you. Hopefully that shows you how complex this can be, this treatment. This is why it takes quite a long time to get to grips with it. Right, thank you for that. What I'd like to do now is we can go through the left palm much quicker because we're just duplicating for some of these things, but there are some things that are only on the left palm. So 1 again is the brain and sinuses, 2 is the outer ear, 3 is the inner ear, 4 is the eye, 5 is the pineal, 6 is the pituitary, 7 is just over, nipping over to the other side here, which is the shoulder and arm. 8 is the neck. 'Chest and lung in between those ones. 10 is the heart, which is this whole section here. 11 is the spine going along here. 12 again is that line, which is the diaphragm, with the solar plexus in the middle. Liver, obviously 14 liver we don't have on this side. 15 the gallbladder is on the other side. So 16 we have a wider area of the stomach here. And at the side of that we have the spleen, which is only on this side. And we have the adrenal glands on the edge. Pancreas, which does and extends quite a lot here over both palms. And then 20, which is the kidneys up here, and again going into the urethra 22 and 21, sorry, and 22, which is the bladder on the side down here, duodenum, which is down here, the small intestine, which is this area, which we had on the other side, the large intestine going round that as well, and then the cranial nerves all the way round. So what you've got to remember is that you've got a few things on one palm and not on the others. So quite a lot to do there. If you want to rest your hand, because you've been very patient at doing that, and then what we'll do is we'll move to the dorsal images, which are just the top of the hand there. And if we start with the what we call the left dorsum, and then we're going to just run through and point where these areas are. So that's really helpful, you putting that hand away. So left dorsum we're looking at, and number 8 is the neck, which is along here. Number 11, which is the spine, going along here. And then we have the hip and sciatic nerve, which is on this side, just about here. Then 28, which is the lymphatics of the upper body, which is just on these first 3 sections of this hand. And I remember this is one you've got to be careful of because it's on different fingers on the other side, so you've got to be careful on that one. And the lymphatics, so it's important to get that one right because that has a real impact on protection and working areas that are blocked, which can help you stop getting infections, even things like simple colds. So working on the correct ones for those is important. And then we've got 29, which is this huge area here, which is the chest, the breast and the mammary glands. So quite a large area to work over there. And then 30 down the bottom here is the fallopian tubes and the lymphatics of the lower part of the body. 31, which is here, which is the uterus. And then 32, which is the knee and leg, which is over on this side here. And then 33 on this side, which is the ovaries. And obviously in a man it would be the testes, but in this case the ovaries. Okay, so that's lovely. That's the left dorsum. And then the right dorsum here we've got, it's going back to the neck, looking at it here, which is this area here. And 11, which is the spine, which is this area along here. Then 27, which is coming down from the little finger to the bottom of there, which is about there. So that's the hip and sciatic nerve. And then 28, again massaging sort of in between the fingers really. You've got so this whole area here which is covered. Really it's difficult to show you the move that you would do. I can show you where it is roughly, but the move is almost like a real sort of pulling move, so it's quite difficult to show it just with a pointer. So you'd have to get right in between the fingers to get those lymphatics, but again a very important part of the body to work on. Then we've got that huge area again of the chest and breast and the mammary glands here in that huge area. And then 30, again, the fallopian tubes along here and the lymphatics for the lower body. 31, just on the edge of this here, is the uterus or the prostate in a man. So the uterus in this instance. Then 32 on the other side along here is the knee and the leg if you need to work on that. And then on the other side, 32 is there, and then just near that is it's further down actually here, further down is the ovaries, just around here. And you will feel, that's what I'm saying, it takes a lot of practice on this, but you will be able to feel the ovaries when you search for that. But once you've found it and you get it every time, it really helps to work that area. Okay, so thank you very much for allowing me to use you as a little bit of a guinea pig. As I said, this is going to take some time for me to get my head around all this and to practice, but I need to get these reflex points into my head again. Once I do that, I'm going to ask you if I can practice on you to do a practice treatment, and it's going to take me a while, as I said, so I really do appreciate you offering and volunteering to do that for me, and then hopefully you will get the benefit of some more treatments, doing reflex on the hands as opposed to the feet as well, which I still need to practice, but hopefully we will both benefit from that at some point in the future. So thank you very much for loaning me your hand. Looking at the reflex areas of the feet, and to make it easier to identify each of the reflex points, I'm going to use a reference manual which is very helpfully coloured visually to cover each of the reflex points that you would work on once you relearnt your treatment and your movements in reflex. And what I've got is some coloured marker pens, and I'm hoping to replicate what is in the reference manual. So to start with, I'm just going to cleanse the feet with a wipe just to make sure that they're hygienically clean. So just to make sure that we've got rid of any dirt. On there. Also do that on this side. So anywhere your hands are going to go, and obviously I've washed my hands before the session started so that they're nice and hygienically clean as well. Okay, we'll just wait a little bit, make sure that that dampness has gone. Just check the feet. Right, and then what I'm going to do is start on this left plantar view. So I'm just going to put that to one side so that we've got a clear view here. And I'm going to use the big toe, the top of the big toe, as my reference point. So we're going to start with the brain, and we're going to use this blue colour. and the brain is on the top of those 3 toes. Actually, while we're here and we've got the blue out, I think what we'll do is we will colour in the spine, which they've got in the same colour, so I will do similar. And that you would work all the way down, going on from the big toe to the bottom of the foot here. So that's working up the spinal area there. And as they've got it in blue here, I will follow that. They've got towards the bottom here the sciatic nerve. So colour that in as well. Okay, so that's the sciatic nerve done there. So we'll go back up to the big toe and we'll do the pituitary gland, which is literally just a dot there. And underneath, sorry, no, that is the hypothalamus. And then underneath that is the pituitary, just there. And then we've got the nose on the edge there. And obviously, if it's not highly visible on this foot, we're going to move to the other foot at some point and it will be a bit clearer. So throat there as well. And we'll start going round. So we've done the brain. What we need to do is the side of the neck. Which is under here. There we go. Under the top of the big toe and on the side of the big one. The next one. And you would need to go in with one of your reflex techniques and do that. I might actually go over that in an orange. The yellow, let's try the orange. Yeah, the orange will stand out a bit more. So that yellow is very dull on there. Okay, so that's the side of the neck on this side of each of those toes. Then we've got the eye on this second toe here. That works. And the ear on the next one. And actually, while we're here, we'll do the sinuses, which are in each of these toes. Yeah, because you would just walk your way along those. Then actually we'll use a different colour because we know that yellow is not going to work, to do the shoulder area. So we've got the shoulder, and then at the bottom of the shoulder area there is the armpit, the axilla, just here. So that's the shoulder area there. And then next, across there, let's do that in a pink, I think. We've got the diaphragm, which we can use as a reference point across that. Then we've got, coming down, we've got the spleen, which I'm going to do slightly green underneath that shoulder. We've got the spleen area to about halfway there. Then we've got, let's have a look what we're going to do next. Let's get this colon in, I think. So the colon is quite a big one. So we've got the transverse colon here. Then we've got the descending colon. Then the sigmoid colon, which goes under the sciatic nerve that we've put there, and then back up over here. Then inside of that we've got the small intestine. That works. Then we've done the spine there, so let's go. We know the yellow doesn't work, so we're not going to use that. Let's try a green, I think. So the next one up is actually that pelvis area. And then squeezed in here is the buttock area of the pelvic area. That works. Then let's use a dark blue, I think, to do the rectum and bladder, which comes at the end of the sigmoid colon, so that's over here. That's right. And then you've got the bladder and rectum there. You've got the ureter tubes going up, and then let's try and do a little blob for a kidney shape there. Okay, and then around the kidneys, so behind the kidneys, you've got that stomach area, so that side, and this side here going up is the stomach area. Now what, I think I missed something else out there, which is the pancreas. Yeah, so that's that side of the kidneys, and going into here is the pancreas. Yeah, and that little blob there is the adrenals. Okay, so just above the kidneys you've got the adrenals there. Then behind that you have got the liver area. Just covering that. We've still got the diaphragm there. Then we have the heart. So going from the diaphragm round. There we go. And inside, just the other side of the heart there, is the thymus. we've already done the spine there. So let's have a look. Neck and thyroid. We've got along here. Up to the shoulders there. And actually the one area that ironically I can't find on this, but I know what it is, which is the lung area. Obviously it's on the other side of the heart there. It's that huge area, taking it down to the diaphragm line. And that's the lungs. Now there's just a couple that I've missed just at the top. So we did the neck and thyroid. Oh no, we have. We've got the throat and the nose there, the pituitary gland there, and the hypothalamus there. So we have actually done all of that. That's amazing. Okay. So we've done the plantar view on this left side, so we're actually going to go to the right side now. Okay. I'm not even going to attempt to do the same colouring, so it's whatever works. So we're going to start with the top. Let's see if we can actually draw these areas just so that they're colourful, that you can see them. Well, that one works nicely actually. So brain at the top that you would work on. Then you'd push in for the hypothalamus there, the pituitary gland there. Then we've got the nose here and the throat on the side that you would work on. And actually, let's just go back to that blue and do the spine, going all the way down from the brain. This is probably what you couldn't see clearly on the other side, and I'm using the darker blue so it shows up more. So this is, you're working the spine and the various vertebrae. And then you've got the sciatic nerve coming across here as well. These are good markers to have. And actually, while we're here, I'm going to do the other main marker, because if you get lost when you're doing a treatment, you need some key things to think about. And I always use the brain, the neck and thyroid, which we'll come to, but the sciatic nerve here, and also the diaphragm, which is a good one to locate early on. Just helps you overall. Right, coming down a little bit further, we've got the thymus here. And then we actually have the heart. The majority of the heart is on the other foot. So you've only got a bit of it here. So a much bigger part of it is on the left foot, because obviously the heart is not in the middle. We've done the diaphragm line. So now what we're going to do is that huge area of the liver on this side. Where are we? Going down under that diaphragm line, round about there, so that the kidneys can go into it. So that's the liver area. Okay, and then within that liver area over here is the gallbladder. Okay, so the next area, let's have a look where that is. That little green area there is the adrenal glands. So let's start that there. No, the light, sorry, I'm going to change that because the light green is not coming out on top of the brown I've got there. So there we go. Let's do that. And actually, let's just use the same colour to carry on. So we've got the kidneys. You can't draw a kidney shape with these pens, I'm afraid. So that round blob there is the kidneys. And you've got the pancreas next to it there. Then you're coming down the ureter tube and then leading into the bladder and rectum at the bottom there. Then we've got the pelvis and buttock area here and here. And the pelvis at the very bottom here as well. Right, now we're going to, I wonder if the purple will come out. Got our iliocacial valve. Yep, just above that pelvic area there. Let's see if our darker colour will come out here to create the colon. So you've got the ascending colon and then the transverse colon going in just behind the kidneys there. And then when you work this area, you would work the colon onto the other side. And we have just missed out the intestines, which are just, and actually it's the small intestines just in that area. Yeah, I think I've made the spleen slightly big there, but we know that the small intestine comes underneath the transverse colon, which I've put there, as long as we're aware of that. We've got the gallbladder in there already, I did that earlier. Then we've got, coming up on this side, the armpit, the axilla, which is the armpit, and then going into the shoulder here. And then I think we'll try one of these greens, might work. We've got the sinuses on each of these toes. And then let's see if this light blue will work for the ears and eyes. So 1, 2, 3, we've got the ear there and the eye there. And sinuses we've just done. That takes us back to the brain. And then there's one large area still to do, which is the lungs. Actually, there is one more area as well. So we've got the lungs there. And then I think this is the last one, which somehow we missed going round, which is the neck and thyroid, which is just the base of these 3 toes. There we go. And that takes us to that. I think that actually means quite a lot to me, actually. It's very visual. Should we put them both together? Right, so that's the plantar view done of both feet. So what I'm just going to do is do a quick review. So some of these colours have worked better than others, but we get the general idea. It's really a good, helpful tool to really focus in on some of these areas. And as I said, if you've got a reference point that you're using to have to one side, and that's really helpful. So we've got the brain here, we've got the side of the neck, we've got the eyes and the ears there, we've got the sinuses. Actually, they've faded already. I think some of the colour's gone in, but we did put the sinuses in there. We've got the shoulder area here with the armpit at the bottom. We've got the stomach here. We've got the spleen, the transverse colon, descending colon, sigmoid colon. We've got the pelvis in that green colour there. We've got the sciatic nerve, the buttock part of the pelvis there. We've got the rectum and bladder here, the ureter tubes, the kidney, the pancreas. We've got the, oh, that is the stomach, we've already covered that. We've got the adrenals at the top there. We've got the solar plexus here. Solar plexus. We've got the liver here. We've got the diaphragm line. We've got the heart, the thymus, and actually the vertebrae, which you can't see clearly. You can see it more on the other foot, the spine going all the way along there. The neck and thyroid, the throat, the nose, the pituitary and hypothalamus. Again, that takes us back to the beginning. And just to review this side as well. Thank you. We've got the brain, we've got the hypothalamus, the pituitary gland, the nose, the throat, the neck and thyroid, the spine going all the way down. We've got the lungs here, the thymus, the diaphragm, the adrenal glands, the kidney, pancreas, the ureter tube going down, the bladder and rectum here. We've got the pelvis, or the buttock area of the pelvis first, the sciatic nerve there, the rest of the pelvis here. We've got the ascending colon there. We've got the small intestines, the transverse colon. We've got the gallbladder here and the liver in the background there. We've got the diaphragm line, the lung area, that large area of the lungs, the shoulders, the sinuses going all in there. I've forgotten to colour in the side of the neck. We did have it on the other foot, but yeah, the side of the neck, the side of the toes here should have been coloured in. That's the side of the neck, and sinuses we've done. The ear, the eye, and the last of the brain areas takes us back to the beginning. So I think that gives us a very clear idea of how to really focus on these reflex points on the plantar views of the feet.
Hello.
thank you for joining me today to focus on hand reflexology. So if you want to let me have a look at your hands, and while I'm talking, I'm going to be checking your hands, although we have actually already cleansed them, but I'm just going to give them a thorough check over. So previously we've been tracing and mapping and colouring the reflex points on the hands. Today I want to do something slightly different and take that further and actually do a reflexology treatment and really have a go at doing that as my first attempt of a reflexology hand treatment. What I want to do first is just refer back briefly to the point of reflexology and cover a little bit of the history, how it works, and the benefits while I'm just checking your hands over. So reflexology fascinated people for years, has its history in Chinese therapy, and in about 1913 an ear, nose and throat specialist really looked at reflexology in detail and identified something called zone therapy. And when you look at this, you'll see pictures of the zones. When you look at the feet or the hands, they have mapped zones corresponding up throughout the body. And the idea is that obviously if there are any blockages on any one of those zones, then that's what you need to work to eliminate. That's the basic principle behind it. But it was taken a little bit further in the 1930s by somebody called Eunice Ingham, and she mapped out the reflexology points on the feet, the hands and the ears, and you can also do reflexology, not just, the most obvious one that people hear about is the feet. But actually, if you've got problems with your feet or your mobility, then what do? So one of the alternatives is to do reflexology on the hands, but you can also do reflexology on the ears and even the face. And they're good alternatives to a foot reflexology massage. So how does it actually work in practice? So theoretically, reflexology stimulates all the nerve endings, and they send signals along the spinal column, and we'll look a little bit later where the spinal column is. We've done quite a bit of that when we've done the mapping and colouring in terms of identifying where the spinal column is. But this signal goes up the spinal column up to the thalamus in the brain, and that then produces endorphins. And when these reflexology points are located correctly and we use particular methods, for example, I can feel various parts already just by touching, and if you get those reflexology points correct and accurately, it stimulates the body's whole nervous system to react, and that gives such an element of well-being in terms of inducing things like relaxation, improving your circulation. It releases any blockages, as I was talking about earlier, on those energy pathways or the zones. It gives you an overall sense of well-being, which is what we're really aiming for here as well. Sometimes actually just taking time out for yourself, I think, adds to that whole well-being process. And obviously if you can't do reflexology on the feet, then this is a wonderful alternative in terms of doing hand reflexology. So taking time out, as I said, for yourself is very important, part of that wellbeing process. So what we're going to do now is we're just going to pop some cream on the hands so that it doesn't drag when you're doing some of these moves, and then we'll go into a full reflexology treatment.
Thank you.
Okay, so what we're going to start off with doing is doing what we call some hand relaxers, and this is just a way of getting the hand area to relax. So the first one is what we call wrist loosening. That feels nice and relaxed there, and we do the same on the other side.
That feels nice, actually.
Yeah, just getting that to relax. Because sometimes people arrive and they are quite non-relaxed, and this really, really helps to get them to do that. So that's the first move there. Then what we're going to do is go into a wrist circling move. So you do a few moves around here on this side, and then we'll turn the wrist over. And that just follows through nicely from the first relaxer. Do this side first. It's about 3 to 5 moves of this, depending on how relaxed your client is. And then we're going to do some what we call thumb sweeps. And then on the other side, we're going to do a few what we call thumb rotations on this palmar area here. And this just really helps to relax the whole area. Do the same on the other hand. So a few thumb sweeps on this side. We'll turn it over and do some of these thumb rotations on the palmar side. That ensures that you've got both hands nicely relaxed. Okay, so one of the final relaxer moves is the metacarpal spreading. So I'm going to hold firmly on the bottom here and then just move along the metacarpals so that they're nicely relaxed. Okay, and with the other hand as well. And that just allows both hands to be relaxed and ready for the treatment. So we're going to start with the left plantar view, and because obviously you've only got a small space on the hands and we don't go into as much intricate detail as we do on the feet, so we're going to focus on just doing horizontal moves using what we call a caterpillar move, and we're going to cover as much of the palm as we possibly can. First of all, horizontally across the palm. It's very relaxing while you're doing this.
It feels really nice.
And then once you've covered the palm horizontally, we switch and we do vertically. And you can see this caterpillar move just going down so that you're covering the whole of the palm. And then what we'll do is we'll do that on the other hand as well. Horizontally. And then vertically. Start on this side. Okay, so we're now going to also work the fingers, which is very important. Got the brain and the sinuses in here. The eyes and the ears. And you do this 3 times. And then, just to finish off this hand, you work down this spinal reflex, which is down the side of the thumb and down the bottom of the palm. And then once you've done that, you move to the other hand and do the same on this hand. This is why you've got to keep your nails really short, because that caterpillar move, you can really dig your nails in. You want to avoid doing that. Okay, and again, the spinal reflex. And if you want, you can do that 3 times as well. Okay, and if at any time you feel your client is not relaxed, then do just do some small palmar moves again. That gets them more back into a relaxed state, because you can see here naturally the fingers start curling up and then your client gets tense. So do open up the palm again and do some of those palmar rotations, and that will get your client to relax again. Okay, so we've now finished the plantar aspect of the hands. So if I turn over, we're going to now do the dorsal view. So if I turn over my reference here to the dorsal view and just so that we can see that clearly. And then what we're going to do is actually massage the channels along the dorsal view here, so that you get rid of any blockages in these channels. And they'll be fairly obvious when you try those. And then you have a large space here as well, which you can massage, which holds quite a lot of energy points between the thumb and the finger here. Then we'll do the same on here. So just walk through these channels. And you can do them as many times as you feel is appropriate for your client needs.
That bit feels really good. It is really tense.
You can feel that. So obviously if your client is reacting in any way, or if you can, sometimes you can feel like grainy areas under the skin, then just spend a little bit more time on that area. Right, so one of the final moves we've got on the dorsal view is to really focus on these knuckle areas that hold quite a bit of tension. So if we start over here and just do this as much as is required, especially as it's the last few moves, just to keep your client relaxed. And swap over hands if it's easier to do that. And we'll do this on the other hand, and then we'll come back to finish off there. And obviously the depth that you're using is what your client needs. Some clients can put up with a little bit more pressure, but on small hands, such as this one, you need to have the right pressure, but it needs to be gentle enough so it doesn't cause any irritation or pain. That's the knuckle for the thumb there. Okay, I want to switch back to the other hand, and then what you do is you move down to the other knuckles. So try and relax your hand a little bit more, that's it.
It's so easy to tense up without thinking.
It really is, yeah. And as I said, if at any point you feel like your client is tensing up, then go back and do those palmar moves, or use some of those other relaxers that we did at the beginning, and that will get your client to relax again, and they'll get a better treatment as a result of that. Because you're working in quite a small, confined space, so the natural instinct is for people to react and tense up when people are touching that area. So the more relaxed you can get them, the more benefit they're going to get from treatment.
It's only making me sleepy.
That's what it's designed to do. It's all part of that well-being. Take away the stress, any stress that you're feeling. Anything like these holistic treatments helps to bring back that balance, allows you a little bit of peace for a while. Okay, so if you bring the other area back, what we're just going to do is just smooth as much as possible, just to make sure that it's totally relaxed. And I like to turn over and do, everybody loves these palmar moves. Make sure you cover the solar plexus area there as well. So that's that one complete. And then just smooth down on this side as well. And then just a few gentle palm rotations. covering some key areas there as well. There we go. So that was the first time I've done a hand reflexology in quite a while. How was that for you?
It's really nice. Yeah, I've only really done that or had that done to me on the feet before.
Yeah, it's very different.
Yeah, didn't really know what to expect, but actually I used my hands so much for typing.
Yeah.
They were so tensed up, actually.
I do think these days, with the life that we lead, a lot of people do that. A lot of people are on their phone, constantly using their fingers on their computers. And we use our hands, even in manual jobs as well. We use our hands so much. Our hands deserve a bit of care. And this actually is a holistic treatment as well. So it's looking at those energy lines, taking out any blockages, and really giving you that overall sense of well-being, so that you leave the treatment thinking, actually, now that I really have benefited from that. And the beauty of this is that people can do it on themselves as well. So a bit of self-hand reflexology on these crucial areas can really enhance that overall sense of well-being. So thank you very much for your help today. Yes,
Hello.
thank you so much for volunteering again to help me with one of my other therapies, which is reflexology, which was really the toughest therapy for me to learn. Not because I didn't love it, I absolutely love reflexology, but there is so much to learn on this one, and it's very complex, and it's going to take me quite a while to get back in to knowing all the things that I need to know in order to give you a good treatment. So one of the things that I thought we'd start off with is just really looking at the feet and where the different areas of the foot correlate to different parts of the body. Because as you may have heard about reflexology, there are what we call transverse and longitudinal zones of the feet, which then connect to other parts of the body. And the original thoughts on reflexology were that there were 10 longitudinal zones. So, for example, you would have one zone going down from each toe, which would correspond upwards to various systems and parts of the body. And equally, there are some transverse ones as well. And that was originally introduced by an American ear, throat and nose surgeon, ironically, who came up with zone therapy. That was replaced later by somebody who mapped out that in a lot more detail and did a sort of map of the feet. And you can see here, I've got a lovely diagram here of the bottom of the feet, and you can see there's an index here of all the different parts of the body and what it relates to. And later on, you can see it's not just the bottom of the foot, it's the side and the top of the foot as well, which is known as the dorsal view. So what I thought I would do, and really this is you helping me, is try and get me to memorise some of these areas of the foot. Hopefully you're going to jog my memory system, and hopefully get some benefit as well, because once I've got this in my head, I can then move on to start giving you a reflexology treatment. But my first thought when I looked at this again was, I really don't remember enough about it, and I need to be much more knowledgeable about the different areas of the foot. So I'm using you as a bit of a guinea pig. So what I thought would be helpful, hopefully you're not too ticklish.
No, I'll be fine.
Is really use this wonderful picture, and this is one that was given to me by my lecturer many years ago. We're talking about 14 years ago now. It's a very well-known diagram of the different areas on your foot that correlate to the different parts of the body. So I'm literally just going to name them, And then I'm going to hope that that stimulates some memory in my brain as well, because I really want to get back to reflexology and doing the treatment as soon as I can, but I need to be a little bit more knowledgeable first. Right, okay, so we're going to make a start. So, number one. Number one is the brain and sinuses. And according to this diagram, it's literally the top of the toes, because obviously your brain covers the whole of the top part of your body there. So that is each of this little spot there. So that's number one. And I'd see I've immediately gone to the move that I would do in reflexology. So clearly the memory stimulation's working. So that's absolutely fantastic. So brain, got that in my head already. Then number two is the outer ear. And this is a little bit challenging to find. You actually have to go in with your fingers, but I'm just going to show you so that you can feel it. It's there on the side of your pinky, your little toe, and there. And that's your ears.
Oh, it's right on the inside.
It is. So you have to really when you treat, you have to really get your fingers in. And it's the same on the other foot as well. Then we've got number three, which is the inner ear, which is on your smaller toe here and this one here on the inside. So you have to really get in and treat that. Number four, which is the next toe inside there, and the next one here as well. And that is the eye. And where's number five? Oh, I remember this. Number five is way up here, which is the hypothalamus and the pineal, which is that. So once I start treating you again, I'll be able to actually feel that. Number six, which is this one here and here. So there and there is the pituitary gland, which is great. And then number seven is right in here. And that is the side of the neck. So you can see, because I can see from here, if you go upwards like that, you can see how it goes along the body up to your neck. So it's in the same zone. And there are 10 zones, because obviously you've got 10 toes, and each of the zones go upwards. And I could be treating one part, and it's almost reaching the other part of your body in that zone. So if I'm treating zone one, I'm almost treating everything in that zone to make sure that it's all cleared of toxins and things like that. The whole point of reflexology is to get the body to stimulate its own healing. Reflexology itself doesn't fix things, it actually activates the body and helps the body to activate healing.
That makes so much sense. I don't think I've ever fully grasped that before.
Yeah.
Because I think when things get quite confusing is when people think reflexology fixes everything by just pressing parts of the foot, but that makes so much more sense.
It does. It's similar to acupressure, although acupressure works off meridian lines. It's slightly different, but it's the same sort of the pressure that stimulates that sort of healing mode, and different parts of the body can be healed alongside that. And obviously, it's working to get rid of toxins and tiredness and all of this sort of thing. There's lots of anecdotal evidence. Obviously, the scientific evidence is limited. But lots of doctors do believe that there's an element of that.
I think even if it's just, say some people thought it was placebo, if a placebo works, that's powerful in itself.
It is, you're right, and the placebo effect is a well-known effect of reflexology. Right, so let's have a look where we've got to. 7. Number 8. So number 8 is the cervical spine part here, or the cervical part of your spine, which is this area along here. That's interesting. It's like looking at a jigsaw puzzle. I'm just going to have to make that slightly larger. Okay, number 9. There we go, number 9. See, when I was studying, we just had a piece of paper. We had to keep bringing this up and down. Now, obviously, I've got a wonderful iPad here with a very colourful diagram. It makes life so much easier, because if you're unsure, you can just enlarge it and bring that up. Makes life a lot easier. So number 9, if I draw that line there, and it's this whole area here is your shoulder and your arm. So if I've got a client who is struggling with shoulders, I know you've had problems with your shoulders as well, this is the area that you would work on. So this part of your foot, you can see it almost, if you look up, the zone's going that way, reach your shoulders. From here I can actually see them angled. So if I was working along these bits, that would be your shoulder, and working on that to stimulate some sort of healing reaction, which would be good. Number 10 is your eustachian, and we would work along these areas here. Okay, and then we've got 11, which is just under here, which is your neck and your thyroid. So that's that tiny little bit here. And one of the reasons reflexology took me so long to learn is it's very precise. Some of the movements are very, very small, and it takes a long time to learn how to do the various movements. So once I've relearned where everything is, then I need to go back to practicing the various movements, and hopefully you'll help me with that as well. Okay, let's look at number 12, which is the bronchial and thyroid, or thyroid helper to be more specific, which is this one here. So coming down there and coming down there. So that's bronchial. And then, 13. Gosh, why is that so? Oh, okay, that's interesting. So 13 is the chest and lung area. So it's actually quite a wide area. I do remember this because I think when you get to treat it, you have to do quite a few moves around it. So the lung area is this huge area here. So chest and lung. And then I always find this interesting because on the heart one, the heart is really interesting because it's here. This is number 14. But then it on this side, which if you do it the way it is actually your left side, comes in much further. So you have to treat much further in on this foot, because your heart, although people say, oh, you know, your heart's here, it's actually slightly over to the left. So slightly more of it is over to your left, which actually, if you can see on this diagram, I'm going to show you. You can see it's slightly more over there and the tiny bit here. It's really interesting. I know, fascinating. Right, where do we get to? Heart. So heart and it's number 14. So number 15 is something called the esophagus. It's funny spelling, funny word to look at, but it's, I think I've pronounced it correctly, esophagus. It's spelt Oesophagus. Very unusual spelling. And it's only on this foot, and it comes down there, right across the heart, and stops about here. Really interesting. So you've only got to work it on this foot when you're working it. Right, number 16 is the thoracic spine. So you've got this on both areas. So you can see your spine obviously covers both sides of the body. So actually it's the inside part here all the way down your foot, the insides of both feet. Right, so the inside of your feet is where the spine is. So the thoracic spine all the way along here. So it starts about here, because 8 is the cervical spine here, so the thoracic spine comes all the way down just to about there. Yep, that's good. And then after that we've got number 17, which is, if I remember, the diaphragm, which is this area along here. So let's try and draw it with here, there, and just that area. So that's your diaphragm, so this area of your chest. And then, if I remember right, in the middle of that is the solar plexus. Yeah, hey, got that right. So solar plexus, which is here, which I've even remembered the movement for that, which is slightly just pressure. And you find with reflexology, as I said, the movements are so precise. And this one is just a slight pressure, but you can feel where people have got issues, or I can feel the difference between what it should be and what it shouldn't feel like. Often there's like crunchy grit, or it feels like mini crystals. Sometimes it just feels slightly more swollen than it should, and then that indicates to you that there's a problem in that zone, which you've got to work out what it is and maybe work on it to stimulate that healing element. Okay, so 19 is the liver on this side. So liver quite large here. There we go. So those of you that can see the diagram, it's the big diagram there. And then 20, which is just within the liver area, is the gallbladder here, which is just on that side there. Then we move across to 21, which is this huge area on this side, which is the stomach. So that's that area here, on the stomach. And within that stomach area, just over here, is the spleen area as well. Then we've got 23, which is the adrenals. Oh yes, that's just this tiny area here, which is the adrenals. And then 24 just underneath that, which is the pancreas, which is there. Pancreas, a tiny little bit of it on the other side as well. And then you've got the kidneys, obviously you've got 2 of those, on either side, just like a sort of funny shape, kidney shape. And then we've got something called the waistline, which we'll talk about when we talk a little bit more about zoning, or transverse zoning, but you need that as an indicator, which is the waistline. So it helps you to navigate above and below the waist. So it's more a navigation tool, but that is your waistline there. And then we'll go back to this, which is 27, which is the, so if we go from 25, which is the kidneys, and then 27 is the tube known as the ureter, which takes obviously the waste from those kidneys on both sides, to 28, which is the bladder. And actually it's a little bit further down here, the bladder. Feel it on yours there. Oh, right, 29, gosh, okay. Yes, I should remember this one, because this one always stumped me before as well. So 29 is the duodenum, which is actually to a little bit to the side of the kidneys, just this area here. Okay, and then we go back to looking at the slightly larger areas, which is the intestine. and the small intestine covers a huge area. So it's called the small intestine. It's actually quite a large area. So that's on this foot and on this foot here as well. Oh, I think I've sent you to sleep already. Is it very relaxing hearing about different parts of your body?
Keep exploring.
Oh dear, not to worry, you carry on. You're being helpful to me, so that's fine. And then we've got 31, so there's quite a lot of small areas here to look at. So 31, which is your appendix, 32, just slightly above it, which is something called your iliocacial valve. And then 33, you've got the ascending colon. And this is very important because at some point, from memory, I do remember you've got to work your way all around the colon, and the colon covers both feet. So you've got to move from one foot to the other when you're doing this very intricate move. So you've got the ascending colon, 33. 34, which is the hepatic flexure here. Then you've got, and this is only on this foot because, as I said, you've got, when you do your intricate moves later, you are moving from one foot to the other all around this intestine. So ascending colon, hepatic flexure, and then you've got the transverse colon, which takes you along this foot and then over onto what would be your left foot. And then along there, just at the top of there, you've got something called the splenic flexure. And then you've got the descending colon coming down to the very bottom here. And then you've got the sigmoid colon. And then 39, which takes you back to the lumbar spine. So when we came down, I stopped earlier on this spine area. This part down here is the lumbar spine area. So that takes us to that area, which is quite interesting. So that I find quite a therapeutic area, and I know that I've massaged people before around that, and that seems to have quite a big impact. People often get things stuck in their colon, and it's almost like doing that seems to shift things, which is good. Right, then we've got, that takes us to the lumbar spine here. And then after that, we've got the coccyx. So that relates to the coccyx, and that's on both sides of the foot then, or both sides of the feet rather, on the inside here. And then that takes you to 42, which is the bottom part here, which takes you to the sciatic nerves. And then I think we're done on this diagram. That finishes that off and takes us then to the side of the foot. So that's quite a lot. So one of the reasons that I found reflexology totally fascinating but very challenging to learn is there is just so much in a very small space, and you have to be so precise in terms of your knowledge. And that really takes us to covering the whole of the bottom of the foot. So it gives us a very good idea of all of the things that are covered in that area. So quite a lot, you can see. Okay, let's move on to what we call the lateral view of the foot. So we talked about where the shoulder was and the sciatic nerve at the bottom of the foot, but there's an awful lot of things on the top of the lateral view that you have of the foot, and I'll try and point out where all of those are. So we spent quite a long time looking at all the various parts of the body from the bottom of your feet, but also there's a lot of different parts of the body that are connected on the top of the feet that you have to know about as well. So we looked at where the shoulder and the sciatic nerve were, but then on the top of the feet here, there are some interesting ones as well that you need to know about, which you can treat with these precise movements that I talked about previously. So for example, this is using a diagram that I was given as a student, which is much clearer on the iPad actually than the sheet of paper I used to learn from, simply because the colours are much more vibrant and you can see the difference area. I wish I had something this colourful when I studied many years ago. So 43, for example, which is just this area here, and obviously you would do the same on the other foot as well. So 43 here is the upper jaw, teeth and gums. So if somebody's having particular problems with their teeth, obviously this is something that you would work across to really try and stimulate your body healing your teeth, but through your feet. It's totally fascinating. And 44, which is just below that, there, is the lower jaw, teeth and gums as well. So you've got upper jaw, just slightly higher, and then lower jaw, slightly there. Then 45, which is almost the bottom of the foot here. So when I was doing my reflexology moves, it would be along here, slight. So there's nothing there at all. But if for somebody that was having sort of neck problems, or they might have something wrong with their throat, for example, tonsils maybe, or thyroids, you would be able to feel something in that area because it's on that same zone, that longitudinal zones that we were talking about earlier. So one of the 10 longitudinal stones, and this correlates right up to your throat and your tonsils. So 46 vocal cords would be underneath that neck area. And then 47 is the inner ear helper, which is this area here. And then if you go back to the area under the vocal cords, that is something called the lymphatics of the chest, because you can see that's in the same zone there. And then 49, very large area here, which is all covering the chest, the breast and the mammary glands. So obviously quite a wide area, because obviously that covers the whole of your breast area on this foot and the other one. And then 58, which is this area right over here. It's almost like a triangular space, and that's your sort of leg, knee, hip and lower back. So if obviously people have got lower back pain, you would be working in this sort of triangular area here. You pop your foot to the side slightly, there we go. See that area here, definitely. And then 59 is your hip area, which would be this area along here. And then we've got 60, which is always a tricky one to find when you're doing reflexology, but through time and patience you often find where it is, and that's the ovaries or the testes in a man. But that's roughly around here, but you do have to feel around for it. And often it's actually quite a hard area, and that relates actually to your ovaries. Sometimes you can tell if somebody's having a period, for example, it's quite hard, and you can actually help to relieve the pain from PMT and really help people relieve that pressure there. Okay, so we finished the lateral view of the foot, and we're going to move on to looking at the medial view of the foot. And this is this area here. So one of the first things to look at is the spine area, which you can see is the zone that goes up the middle of the body. So the spine area is this part of the foot. So let's look at it more. It's probably easier to do on this one rather than your left foot. Let's do it on your right foot. So we would start here with the cervical spine. That then moves into something called the thoracic spine. Then you've got the lumbar spine area. the sacrum and the coccyx here. Then above the lumbar spine is the bladder area here, which you would work across. And then that would take you to the uterus and prostate on a man, obviously, uterus on a woman, which is this area just up here. Then moving slightly above that, along this area here, you've got the fallopian tubes, which makes sense coming up from the uterus there. You've got the fallopian tubes and the vas deferens. One of the things about reflexology is you have to really have a good understanding of all of the different systems of the body. So there are words here that, like fallopian tubes, the vas deferens, the iliocacial valves, all that, they're used a lot in the body system. So you have to understand like the endocrine system and the reproductive system, those sorts of things. So when you study reflexology, you don't just study this, you study the whole body, and that makes it relate to what it is that you're looking at. So some of these don't make sense until you've studied the system, and then they make a little bit more sense. So up here you've got the fallopian tubes and vas deferens there, and the lymphatic system, which is another system you would study. And then 52, you've got the lymphatics of the groin area here. And then you've got going back here, you've got the vagina and the penis for a man as well. And then at 56 here, you've got the uterus and the prostate, which I think we touched on earlier. And then 57 is going slightly up here, which is all the areas of the reproductive system along here, which you would obviously need to study to understand how that all works together. Okay, I think we've mostly covered most of that. So along the spine and upwards here and the reproductive areas. There are just a few areas we missed out. There's one here, which is your mid-back area. So if you've got pain, obviously we looked at lower back earlier, but in your mid-back, then this would be an area that would maybe be slightly bubbly or slightly grainy that you would pick up there and work along. Then I think we've missed out the nose, which is this funny area here. And then I think that we've covered everything now on that medial view as well. And that's really giving us a very good idea of all those different aspects of the foot and how they relate to the different parts of the body, and gives you a very simplistic explanation of those 10 zones of the body. So if you think here, if you bring your other foot up for me, so you've got your 10 toes, your 10 zones of the body, and then if you're starting to work on those areas that I've pointed out, you'll probably find it will work up. You might even get some tingling sensations in those areas. And that's really that sort of pressure movement and all these different precise movements that have an impact on the rest of the body. Obviously, one of the other things that you need to know about, which took quite a long time to learn, is you need to be very familiar with the different sorts of ailments that people can suffer with on their feet, so that you can't treat them. So there's a long list here, for example. You've got, literal basic things like cuts or bruises. You have to be really careful if somebody's got a fracture, that you don't treat that. If there are lumps or bumps on the feet, you mustn't treat, because remember, we're not doctors. So we're not diagnosing, we're just trying to help. Even something like sunburn or scar tissue, then you need to avoid treating those people. There's also things like eczema that you need to be aware of, that you don't irritate the skin. It's one of the reasons we don't actually, well, there's two reasons not to use oil. So in our other treatments like body massage or aromatherapy, or Indian head massage, obviously we're using aromatherapy oils to stimulate the senses and to relax people. Now with the feet, you don't really want to do that, and the other reason is the oils will make your fingers really slippy, and as I mentioned, there's really precise movements here that you need to use. You can't do that if the foot is slippy. So what some people use is talc, but you have to be very careful with the type of talc that you buy, because some good old-fashioned talcs have still got carcinogenic elements in them, so you want to avoid them. So be very careful what you buy and put on your feet there. But you can use creams as well, which is very nice. Even like a simple moisturising cream will help you just smooth so that you don't catch on the skin, but allow you to do those precise movements. There's lots of nail and fungal infections that you get on your feet, so you really need to look out for those constantly. And what you can do if you've got something is spread it quite easily, because you're moving from one foot to another, so you don't really want to do that. So you really need to look at the feet very carefully. Things like athlete's foot, for example, can be quite contagious and you can spread that, so you need to really look at those in quite a bit of detail. And obviously if you see something like a black mark, could be verruca or something like that, you want to really avoid that area. You won't be able to treat that. So it's really understanding the foot. So a lot to learn in terms of reflexology. I think my manual for reflexology was about 4 times the size of any of the other treatments that I learnt. So you can see why you have to learn the systems, you have to learn all about what to look out for, you have to learn the diseases of the feet as well, and then learn the movements, which are completely different to obviously general massage. So thank you, that has been so helpful. It's going to take me a while to get all of these different areas into my memory banks again, but it is coming back to me, and the next stage will be for me to get very familiar with these precise movements, revise a little bit on the body systems, because obviously it's a long time since I've looked at those, and then what we'll work towards is doing an actual proper reflexology treatment. So once I've restudied some of those systems, really get a better understanding of what the gritty feeling and the slightly swollen areas of your feet actually mean in terms of the rest of your body, and then hopefully work on really increasing that healing element. Thank you for your time.
Thank you. Hello.
Thank you for joining me again today, and you've kindly agreed to let me go over the reflex points on your hands today. So if I can just have a look at your hands, and while we're talking I'll just slowly have a look at the hands and just check that there are no problems with them. And what we are going to do today is start with the plantar view of the hands, and I'm going to use this wonderful view that I have on my lovely reference image here, and then we're going to move over to the dorsal view, and I have my selection of colouring pens to mark the regions as we go, which hopefully will really make these stand out and show people where these regions are much more clearly on the hands. I am going to attempt to colour each of the areas in. Hopefully it will be very clear. It might end up being a little messy, but hopefully it will make the different areas stand out much more clearly on the hands if we actually colour them in. Right, so we're going to follow the image as I've just been through. So we're going to actually start with the right plantar view, plant or palm, it's often known, but officially, formally known as the plantar view. So what we're going to do is follow this image round, and we're going to start with the shoulder. And I'm going to draw this as much as I can. So it's coming from that second finger down. And that's the shoulder. Right, so moving on up, the next one will be the gallbladder. And the gallbladder is just here.
It's so nice seeing all the different colours and the regions. I love it. Actually,
They are lovely, aren't they? They're really nice. So let's move on to, I'm sorry, I've picked up the wrong one there, because the next one along from that is actually the lungs that we're going to do. And we'll go back to do the sinuses in a moment, but we're going to do the lungs here, which is quite a big section. Obviously quite a big section because the lungs themselves cover quite a large region. So that's the lungs now finished. And then what we're going to move on to is the sinuses. So they have a lovely green here, so we're literally just going to follow what they've done. So sinuses cover these top three areas. Okay, that's the sinuses finished. Now we're going to move on to the ears. I'll do that in a dark blue, I think. And that is closely followed by the eyes on the next finger up. Okay. And then we have the pituitary, which is just on the edge of the thumb. And then we have the heart, which we're going to colour in. So I do the outline of it, and then we'll colour it in. That's the heart area, and then what we'll do is move down slightly, very similar colour, onto the thyroid, which is right across here. And also the adrenal glands, which are just in here. In fact, I think they're a little bit further in as well. There we go. That's better. And then just on the very edge of the adrenals there is the pancreas. Actually, what I'm going to do is I'm going to swap that to a different colour. It's too similar. So I'm just taking out a slightly darker colour. And that's the pancreas, which I'm going to colour in. I'm going to try the slightly thicker side. Yep, so that's worked. So that's the pancreas completed now. And then what we're going to move to is the, what's the next one there? That's the kidneys. So I'm going to attempt to draw a kidney shape here. I'm going to try and draw this. There we go, slightly kidney shaped. And then we're going to follow that through with the ureter, which takes it down to there. Then we're going to do the sorry, I'm going to choose a different colour pen. Then we're going to do the transverse colon, which is underneath where we were. Through the kidneys there. I'm going to try the other end and see if that will mark in a slightly brighter colour. There we go.
Oh, goodness.
So that's marked out the transverse colon a bit better there. Brighter colour. Then you've got the bladder just at the very end of here. Okay, we'll do the spine, which goes all the way here and all the way up. So that you can work this part, spine, particularly for people who've got back problems. That's where you want to focus your reflexology moves. So we've been following this image very carefully, and we've literally just got these two large areas left, the small intestine and the liver here, and then we'll finished this plantar. Okay, so we're going to colour in the large area, which is, funny enough, the small intestine, which is actually quite a large area. So we'll see how much of this we can complete, so that we get a rough idea of what this covers. I don't want to go too far into the other colours because they'll start blending. Okay, so that's the end of the small intestine, and then we've got the very last one on this right plantar, which is actually the liver. So the liver covers the remainder here, and this would be in between these as well, right up around this area. Just showing you what you would work in terms of the reflex points here. Okay, that is that right plantar fully completed. Okay, so I'm just going to roughly compare the image that I've created with the image that I'm using as my reference point, and I think we have everything there. So we've got the shoulder, the gallbladder, the solar plexus, the lung area, we've got the sinuses, we've got the eye and the ear on this side, we've got the pituitary, which is hidden on the thumb there, we've got the heart, the thyroid, the adrenal glands, the pancreas, the kidneys, the ureter, the transverse colon, we've got the bladder as well, and the spine. We've got the small intestine. We've got the ascending colon, which I'd already done there, and that completes that right plantar. Okay, so we've done that hand now on the right plantar, so we're going to move to the left plantar. And I'm just going to move the pens over here, and then I'm going to try and mirror what I've done on that side, following this diagram again, and follow similar to what we've done. So we're going to start similar to what we did before with the shoulder area, which is here. Shows up well in that nice bright blue. And then on this side, one thing that you do have is the spleen, which comes under here. Let me just try with the other end on that. Might come up a bit brighter. Yes. Okay. Then we have the descending colon, which I'm going to draw here. Okay. And then we're going to go up on this diagram to the stomach area. So okay, so stomach area completed. So we will look at popping the solar plexus in there. on the edge of the stomach area there. Very important. And then we've got the lungs, which is just coming up here. Then similar to the other side, we've got the sinuses. That's the sinus area complete. And then we have the ear. And then the eye next to that. And actually we'll use this bright green to point out the brain so we don't forget it. Very important to have a brain. And then we've got this large area here, which is the heart to complete. So that's the heart area done, and actually we're just going to use this to locate the thyroid. Just pointing out the adrenal glands we've included earlier. Do that. And might try and fit the pancreas just down here. And then I'm going to draw, as I did on the other side, attempt to draw a kidney. So kidney shape-ish with the ureter going down. And then the colon we've already got in there. When we did the descending, we added in the transverse colon along the top. So transverse here, descending colon here. I think my drawing ability just carried on. Right, at the end of that as well, we've got the bladder, just at the end of that. And again, similar to the other side, we've got the spine coming along. All along the edge here to join up to the brain there. Then we have the large area, the small intestine, which covers this large area. That's the small intestine, which covers everything on this left side of the plantar. Okay, so we'll just make sure that we've covered as much as we possibly can on here. So we've got the shoulder, the spleen, the descending colon, and then we went to the stomach area, the solar plexus, the lungs, the sinuses, the ear and the eyes, pituitary at the top here, the brain along the side, the heart. We did the thyroid, the pancreas, the wonderful kidney there. We did the ureter. We did the transverse colon. We did the bladder, the spine, and the small intestine. And that completes both of the plantars, which you can see wonderfully portrayed there. Okay, so now we're going to move on to the dorsal images, and we'll just have a look at the reference point for that. We are just going to use these images as reference points for the dorsal view of the hand and just colour in these areas that they've got to make it clearer where the reflex points actually are on the dorsal view. Okay, now we've completed the plantar reflex points, we're going to turn the hands over and we're going to finish off with covering the dorsal view of the reflex points, and we're going to colour those in as they've shown in the reference here. Okay, so we're going to start with the left dorsal view, and we're going to start on the left side here with what would be the ovaries or the testes on a man, which is just on the left here. And then we have the fallopian tube, which takes you across to the fallopian tube, which takes you across to the uterus and prostrate. Actually, we'll use the same colour just to identify the thyroid here as well. And the pituitary, which is going to be at the top slightly the inside of the thumb, so difficult to show here, but it is in there. Then we've got a large area across the top here, which covers the breast or chest area, and that needs working, particularly if you've got people who've got problems in that chest area. Just going to try the other side, see if that will mark a bit better. Yeah. Quite difficult to do on the hand here because the hand's quite bumpy here, but I think that gives you a very good idea of the breast and chest area. And then very similar to the plantar view is the shoulder continuing along here. And then on the side here is the knee that you would work, this area here as well. Okay, and that finishes that left dorsal view. So we're going to try and mirror this on the other side. So again, we'll start with the ovaries over here, and then we'll use this white colour to show the fallopian tubes coming across to the uterus. Then we will just pop in the thyroid along here, and again the pituitary, which is difficult to depict, which is just on the edge of the thumb there. Then again we'll show this large area of the chest and breast area. So this is always a difficult one to colour in. It's quite bumpy. So there we go, and then we've just got the last two areas here. One being the shoulder, and then the last one on this side, which is the knee. And that completes the dorsal view. So you've got both hands here of the dorsal view, so just running briefly over this. We've got the ovaries and the fallopian tube, the uterus, the thyroid, the pituitary, the breast and chest area, the shoulder and the knee, and very similar on the opposite hand, on the right hand of the dorsal view. So again, starting on this side with the uterus, the fallopian tube and the ovaries here. You've got the knee, the shoulder, the breast, chest area, the thyroid and the pituitary. And that completes the dorsal view of looking at and mapping those reflex points, making it very clear where they are, and the colour really helps to make that a visual element in your head, so that if you're practicing reflexology, in particular self-reflexology, this is one way of getting to grips with where these reflex points are. So that completes our session today. So thank you very much for allowing me to identify and look at these reflex points again. And actually the colours really enabled me to pop that clearly into my head. So I actually think when I go back to that again, I'll be able to do that as a treatment with these images. And what it also means is that those who want to do self-reflexology can visually see where these reflex points actually are. So thank you for sharing that journey with me.
Thank you for having me. It was fun. Thank you.